You went to the doctor and you got your thyroid tested, and they told you everything looked normal, but you still fell off. This is one of the most common and frustrating things I see in women all the time. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative physician. And if your body feels like it is changing in ways that you can't explain, your energy, your weight, your mood, your thyroid could be at the center of it. So why do you feel so awful when your thyroid tests are normal? The big reason is, most of the time, is the doctor that is looking at your labs or just isn't going deep enough. So in basic medical school, when you go to medical school, you learn, okay, to identify a thyroid condition like hypothyroidism is you just order a TSH. And if the TSH is normal, it's in the normal range there, they don't have a thyroid issue. And that really was false doctrine, I would say, regarding that, because when I started looking into the thyroid, started going to a lot more detailed conferences into thyroid and endocrinology, it's really, that's so small. It's one little piece. Yeah, TSH has a feedback loop and all that, but the body doesn't work perfectly that way. So let's talk about what is the difference between normal ranges and optimal ranges. So I call this the sick norms and optimal norms. These normals that they get is based on a lot of people going into the doctor. Most people that really go to the doctor usually don't feel great, right? So that's where they get their norms on. All these people that have this data point here and be like, this is normal. So for a TSH, it's 0.45 to 4.5, maybe up to 5, depending on the laboratory that you're using there. Of 4 or 5, I'm definitely thinking you have a thyroid issue, because it ideally needs to be below 2. What should a good thyroid workup include? I always want to do a TSH, a free T4, a free T3, a reverse T3, and thyroid antibodies. That is when I think someone has hypothyroid symptoms. That's what the labs need to be checked. Not just a TSH, not just a total T4 or T3 reuptake, which is what a lot of basic conventional docs or even endocrinologists are ordering. Now, if you have, say you're having symptoms of more hyperthyroidism, you want to get a TSH, a free T4, free T3, a reverse T3. You want to get thyroid antibodies, but also you want to get something called a TSI, thyroid stimulating immunoglobulin, because that's where we're going to get that confirmed diagnosis of Graves' disease, which is very common there. So those are the ideal tests that we want to get ordered. When I'm evaluating patients, I definitely take medical history into account. So I'm going to do a very detailed history, ask a lot of different questions to identify what is the true cause of what's going on. It might be hypothyroidism, or it could be all kinds of other things that could lead to the same symptoms of hypothyroidism. Type of symptoms that they experienced in the past, or what type of infections that they may have been exposed. This really gives me a good idea of what we need to dive into and really be able to order the appropriate tests and give them the appropriate treatment. So when I diagnose thyroid conditions, I like to often do a physical exam. So with the physical exam with the thyroid is you're going to be looking at the size. So the thyroid is located right here. So what I'm looking for is if it's looking kind of puffy or enlarged right here, I'm thinking, okay, they have an inflamed thyroid, something's going on there. I also have them turn it to the side and see if I'm seeing a bigger silhouette or a shadow, which is going to show up when we're doing the physical exam there. So are there specific supplements, dietary things, nutrients, herbs that you can take to help support the thyroid? Yeah, there's a lot of them. And really it's identifying, okay, a lot of it's nutrient deficiencies, but you need to order the blood work and actually see if you're deficient in these though. And iodine is more than just checking your serum iodine. You probably want to do more of a serum reuptake type of iodine test. This is telling us what your body's actually holding on to. There are some herbs that we can take to help support the thyroid function and help it wake up a little bit. So there's a lot of different herbs and nutrients that we can use to help support thyroid health. In the next video, we're going to talk about the various types of thyroid conditions, because not all thyroid issues are the same, and that changes everything of how we approach treatment. If you've been told that your labs are normal and you don't feel normal, book your free consultation using the link in the description so we can get the real answers and actually figure out what is going on.